Welcome to this educational video on the application of an anterior pelvic external fixator, often called an X-Fix. Today, we're going to walk you through why this procedure is performed and how it's done in the operating room. Pelvic fractures are serious injuries typically caused by high-impact events like car accidents, falls from height, or major trauma. These breaks in the bones of the pelvis can make the ring structure unstable, leading to pain, bleeding, and potential damage to nearby organs, blood vessels, or nerves. Now, let's dive into the procedure itself as seen from the operating room. The patient is under general anesthesia and has been draped to create a sterile environment. We start on the right side of the pelvis. First, a small incision is made over the iliac crest, the bony ridge you can feel at the top of your hip. This allows access to the strong internal bone where the X-Fix pins will be anchored. After incision, we carefully dissect through the soft tissues to reach the bone. This step is done gently to minimize damage to muscles and other structures. Next, we insert the pins into the bone. To ensure precise placement, we use a C-arm, which is a mobile X-ray machine that provides real-time images. This helps us guide the pin's length and trajectory, making sure it's securely in the bone without going too deep or in the wrong direction. The pin is drilled in and we confirm its position with the additional imaging. Here, Dr. Staples directs the X-ray tech to adjust the C-arm angles to get the most appropriate views of the pelvis to judge pin depth and direction.
And then I want to go 35 towards the head on the end of that one. Then go towards the edge of your base.
Sorry, say it again.
Towards the head. A little ways. Like that.
With imaging confirmed, we can readjust our trajectory to ensure best placement in the bone.
X-ray. X-ray. Alright, come back to the Jude now. Towards you.
We then repeat the same process on the left side: incision, dissection, and pin placement using the C-arm for accuracy. Symmetry is key here to ensure the frame will align properly.
That's the walk again. X-ray. Wants to walk off the side there a little bit. X-ray. Okay, good. Then show me again 20 towards you and 35 towards the head.
With both pins securely anchored in the iliac crests on each side, we attach the clamps and connecting bars. These components form the external frame. By adjusting the bars, we can gently distract or pull apart the fracture site just enough to realign the pelvic bones into their natural position. This realignment is vital because it promotes better healing, reduces pressure on the injured areas, and helps restore normal blood flow. Once everything is aligned, the clamps are tightened to lock the frame in place. This holds the pelvis stable, much like a scaffold supports a building during repairs. The entire procedure is done under sterile conditions to prevent infection, and we monitor the patient closely throughout. After surgery, the X-Fix will remain in place for about 6 weeks depending on the healing progress. Patients will be given further instructions about pin site care, physical therapy, and other important aspects of recovery and health.
Okay, show me that. X-ray. So let's tighten this one down. little bit's just the displacement of the anterior ring. But I might, like, once you put the screws in, I might relax it just a little bit because it's almost distracted in the front a little on the right. But it's working. Alright, so now I want to see a inlet view, like 30-degree inlet view of the ring.
While this video focused solely on the placement of the X-Fix frame, the majority of pelvic ring fractures do not occur in isolation. As we conclude the surgical breakdown, we've included X-rays depicting pelvic ring fixation and the various methods used to repair the fractured bones. Thanks for joining us on this video. Make sure to subscribe to the channel as we have numerous videos forthcoming which demonstrate further pelvic ring and other orthopedic trauma surgeries.